Hi, I'm Dr. David Green, CEO of Preferred Pain Center here in beautiful Phoenix, Arizona. Today I'm at the Phoenician Resort, which was a 5-star resort located here in the Phoenix metropolitan area, and is located right on the Phoenix-Scottsdale border. It was built back in the late 1980s as a vision of Charles Keating. So when you think of the Phoenician, you have to sort of forget about the savings and loan scandal and basically think about the beauty of what was built here. It's over 640 guest rooms. They have a championship golf course, 11 tennis courts, beautiful well-being spa, which is what we're right in front of. They have 9 pools, and everything sits up against Camelback Mountain, which is one of the most picturesque mountains here in all of Phoenix. It's named so because it looks like a camel. You have the camel's head and then the hump, and you can see it from all over the valley. The topic for today is cervical spine decompression. Now, I'm not talking today so much about surgery, which is a last resort. I'm talking about the non-operative method of cervical spine decompression. Surgery for the cervical spine for a herniated disc has very good outcomes, but it is surgery, and there are small but real risks during and after surgery, and there's also potential for a need for further surgery down the line. You fuse one level, the next level might see stress, and so forth. The option that I'm discussing is a non-operative intermittent traction machine that we have at Preferred Pain Center that works really, really well in helping patients avoid surgery. Well, what about the traction that goes over the door? You know, the tried and true halter that then goes over the door and applies continuous traction. There are continuous traction methods out there, and those can work as well. But do you want to sit in a chair with the rope going over the door and the every day? It's not exactly a fun way to spend, your morning. Now, there are also some braces that you can put on and sort of pump those up, sort of like you pumped up the tennis shoes with Reebok, but those can work as well. But what I'm discussing is a cervical spine decompression treatment that was FDA cleared back in 1996. Over the last 15 years, it's continually gained in popularity. Why? Because 1, it works, and 2, it's not surgery, and 3, the risks are very low. So when you talk about this, basically it's a table that patients lay on. It's very comfortable. A lot of patients fall asleep during the treatment. There's a small attachment that goes on the machine that pulls underneath the mastoid processes, the bony areas here, in an intermittent fashion that has multiple purposes. One is it tricks the muscles around the neck not to spasm. Because when muscles spasm, it can decrease the effectiveness of the treatment. If you trick them, like this does, it allows the disc to create a negative pressure which pulls in blood flow, along with it oxygen and nutrients and what's needed to potentially repair the disc and bump up the metabolism of that disc. Most discs that have significant problems have very poor blood flow. So what does decompression work well for? It works really well for degenerative disc issues, which is very common in the neck. It works well for herniated discs, where a piece, like a slip disc, where a piece of the disc has pushed out and is pushing up against a nerve root. That's often why a patient has arm pain that's burning, and it can be very disabling. It works really well for helping with that. It can also work well for spinal stenosis, which I've done a separate video on, but it involves getting multiple nerve roots being pinched, and it can cause pain in one or both arms. It can also work really well for arthritis in the neck, or a joint problem where you also see arthritis, but it could be coming from whiplash, from a car accident. It works well for all of those things. Our doctors at Preferred Pain Center use it in conjunction typically with one of the following: chiropractic manipulations, physical rehabilitation like PT, electrotherapy like TENS unit, or maybe interferential treatment, ice, heat, and potentially patients could also see one of our MD, DO pain doctors for either medication or potentially an injection. And I discussed those in separate videos. Well, this treatment usually lasts between 20 and 60 minutes, and it may be 10 to 25 sessions depending on the individual's diagnosis. As I said, it works really well. Studies show over 75 to 80% good to excellent results. For a non-operative treatment, that is stellar. And in conjunction with the other treatments that we offer at the Pain Center, good to excellent results are over 90%. That's what we've seen. The risks are very, very, very low. Most patients, as I said, fall asleep on the treatment table, and it works. So we have some videos on our website at preferredpaincenter.com. Also, the blog of pain discusses a lot of cervical traction issues or cervical decompression. preferredpaincenter.com/blog. And there are educational videos, testimonials. Call us today at 602-507-6550. I'm Dr. David Green, Preferred Pain Center. Your pain stops here.